Welcome back. Dr. Kelly Leggett with Cone Health discussing how to recognize and prevent gynecological cancers. And so this is one of the most important things, and that is the subtle symptoms to watch for, especially with ovarian cancer. What types of symptoms are we talking about?
So one of the biggest symptoms is getting full early satiety, and then also bloating. And what makes it so confusing is that that's a lot of symptoms of irritable bowel syndrome and constipation. And a lot of people write off these symptoms like, oh, it's just, it's my gut, it's my bowels. And unfortunately, doctors do too sometimes. So if you're having any bloating, getting full early, pelvic pain, a change in your stool color, like all of a sudden becoming constipated and you never have been, those are the things you go to your doctor about and ask those questions.
Okay, and so something that we were just talking about in the break is that a lot of times women go to the doctor and they think that one certain test is going to show everything that they need to know.
Yeah, so a lot of people think that just if you have a pelvic exam or a speculum exam, that you're getting a pap smear. And the pap smear is only a test for cervical cancer. So it does not test for anything else other than cervical cancer, not endometrial cancer, ovarian cancer, vulvar cancer. So usually this test is done at your gynecologist office or your primary care office, and you would be discussing it's a screening test. We do speculum exams for a lot of other reasons, but we only do the pap test every 3 to 5 years, and usually done in an annual checkup exam. So, and it's never done in the emergency room. So don't think you've got a pap smear if you've gone to the emergency department.
Gotcha. Okay. So the myth was that pap smear was covering you for ovarian cancer. That is not the case. So that means even more you have to be heightened state of awareness if you're experiencing those subtle symptoms. What should women do? When should they contact a healthcare provider if they're feeling these things?
So never wait for your annual visit. A lot of women are like, well, I don't want to bother them. I'll just wait. It's in a few months. So please make a separate visit with your doctor so they can spend the time needed. But if it happens several days, most days of the month, if it's severe, please make the appointment. But in general, we're there for you. And if you have a question, either send us a MyChart message, or you can to your provider, or make an appointment and take that time and prioritize your health.
Okay, we've got a little bit less than a minute to go. Are there any lifestyle changes that we can make to help reduce our risk?
Smoking can increase your risk of cervical cancer and one type of ovarian cancer. Maintaining a healthy weight can also decrease your risk of endometrial cancer. Obesity has been shown to have your fat cells produce a lot of estrogen, which then can increase your risk of endometrial cancer. Exercise has been shown to decrease the risk of endometrial cancer as well.
Okay, gotcha. A few risk factors there that we can all take charge of. If you missed any of this information, you can find it in our website in the To Your Wellbeing section.